Good evening, Professor. My name is Aarti Seni, and I'm a student of Nursing Leadership and Management at Seneca College King Campus. Today, I will be discussing about my capstone project, part one and part two. So, the topic for my capstone project was the shortage of nurses in emergency department. First, I will give some introduction. Canada is experiencing a shortage of nursing staff in emergency departments, which is mainly contributed by the factor that is the COVID pandemic outbreak. So many of the nurses they quit their jobs due to this pandemic, and many of the hospital staff nurses there are the emergency departments are being closed because of the lack of the support from the government too. So as per the Chetwind and Clearwater, they reported that there is an increase in number of close in emergency departments because of the government lack of support. So in 2021, the number of nursing staff vacancies in emergency department increased to 85.5% as compared to the rate from the past 2 years as per the SBURI 2022. So what were the main causes behind this shortage? This shortage was mainly because of the nurses, they quit their jobs. So I being an internationally registered nurse, I was working back home as a registered nurse. So I also quit job because of this pandemic, as just to save my family, my children. I wanted to protect them. So this was the reason why I quit my job. So here another causes are like there was a workload, there is a workload due to less lack of staff, then there was lack of government support also, and the nurses they feel that they didn't get adequate respect and support, and they are being undervalued. And there was one burnout in the hospitals because of the nurses have to look, one nurse had the nurse patient ratio increases due to the lack of the staffing, and there was overtime and 12 hours shift. And also there was another factor, that is lack of remuneration and the compensation. So these were the factors due to which there is shortage of nurses in Canada. So the next is the effects. So because of this shortage, what are the effects in on the healthcare department? So the patients in the hospitals, they experience long wait times and inconvenience in the healthcare. So due to the shortage, the waiting time has been increased. So this is another big issue which the Canada is facing right now. The patient conditions is becoming acute to chronic, because of the increased duration of waiting time. They are not being given adequate care, and they are being moving from acute to chronic diseases. So lower trust in emergency department among patients. So they have less trust. So the next is the strategies to increase the number of nursing staff in emergency department. How we can increase? Like we can, being a nurse leader, we can provide provision of scholarship to the nursing students. So we can suggest few strategies to the government so that they can take step to solve this problem. So faster license process, this process should be fastened. Make a proper pathway for internationally educated nurses so that they can become RN as soon as possible. Increase in the pay rates to attract the new nurses, and flexible hours, working hours with vacation pay. So now the working strategy. So working plan is that it's according to the 4 stages. First stage is the initial stage where we have to find out the reason why the nurses are quitting job and why the students are not choosing nursing as a profession. Then is a progressive stage, that is evaluation of the reasons and find out the proper solution to the problem. Third is the implementation stage, where we are going to implement the solution. And the fourth one is the evaluation, where we are going to check the nurse patient staff ratio in order to check whether we have achieved our goal or not. Then is the expected outcome. So what is the expected outcome here? There will be a level of satisfaction in nursing staff. So the level of satisfaction will increase. The education workshops and conferences will also help in providing good skill improvement in skills of the nurses. New policies and investment should be done, and good working environment should be given to the nurses. Then is the sustainability plan. So for this, we have to do the survey of high school students to check their course of interest. We have to encourage the students to choose nursing as a profession. And another can be like we have to increase the seats in the schools so that more nurses they are being educated annually every year. So provide stipend to the nursing students and reduce the barriers in the emergency department. So this was the sustainability plan, and this was all about my capstone project part one and part two. Thank you. I hope you like this. Thank you, Professor.